This conversation is taking place at the DuPont Environmental Center in the Russell W. Peterson Wildlife Refuge.
We're talking today with John Carney, Delaware's sole member of the U.S. House of Representatives. We're at the DuPont Environmental Education Center on Wilmington's riverfront. Welcome, John.
It's great to be here. It's beautiful down here.
I think what's on a lot of people's minds in Delaware and our nation is the whole economic situation that our country's facing. There's obvious evidence that we're coming out of the economic turmoil that we've dealt with for the last 4 or 5 years. But I think a lot of people are sort of scared right now about the looming sequester. I think they see that what Congress did a couple of weeks ago, raising a few taxes, but really not doing much about spending. What do you say to your constituents these days about what's going on and what's going to happen?
Yeah, well, frankly, I do more listening than I do talking with my constituents because they're pretty upset, and I think rightly so. And the reason they're upset, I think, is because they expect Congress and the leaders in Washington to at least inspire confidence or try to inspire confidence. And we're not doing that. Many people that I talk to, and economic experts and folks that know a lot more about the economy where it stands than I do, say and are very optimistic about the future if Washington can get its act together on a fiscal plan. And it does require a challenging approach. I mean, it does require that we, as Secretary Geithner said to us in the Financial Service Committee hearing, that we do no harm in the short term. You don't want to dramatically cut spending in such a way that you're going to throw the economy back into a recession. That was one of the big fears with the so-called sequestration, automatic spending cuts across the board. Look, those cuts have to take place, but we need to make sure that they take place, a year, 6 months, a year from now. The latest data that just came out on the last quarter of last year showed negative GDP growth, and it was attributed to a reduction in government spending primarily. Housing was up, private spending was up, investment was up. So it's a delicate situation. And the biggest thing are really our out-year mandatory spending programs, particularly healthcare. And we have got to do something about healthcare costs.
Well, what would you do if you could wave your Carney wand? What would you do?
Yeah, well, I think what I would do is stick to our knitting on what the systemic changes, maybe make them happen faster in the Affordable Care Act. Because we really have two approaches, really. We have two options. One is we can change the incentive structure, as the Affordable Care Act would have us do, that incentivizes results over procedures, right? So paying for results, paying to help keep patients healthy as opposed to just getting paid for another office visit, another MRI, another procedure.
Yeah, it's a real paradigm shift.
It's a real paradigm shift. And it's not going to happen overnight. All the more reason for us to get started on it so that we can fix it and tweak it and shape it as we go. The alternative to that has been proposed by my colleagues, Republican colleagues in Congress, which basically says that we will let federal Medicare and Medicaid spending grow at the economy, GDP plus 1%. So 1% faster than the economy. And the way we'll cap that spending at the federal level is we'll create what are called premium support or vouchers for Medicare. Here's what you get. Anything that you spend over that is on the beneficiary. And block grants for Medicaid, saying here's what we're going to give the states. It's going to grow at 1%, GDP plus 1%. You're not going to get any more, so you've got to help contain costs. Those are the two options. I prefer the first option, which is to work through the Affordable Care Act and systemic changes.
But it was Congress that changed the rules about Medicaid, just for an example, about who's eligible.
You mean in the Affordable Care? No, I think that remains a big question, whether or not we can, net, with all the changes in the Affordable Care Act, the CBO says it reduces costs.
Over the long haul.
Over the long haul. In the short term, increases exposure. That's my concern. Did we create benefits that we can't afford? Are we going to see those long-term savings? Are we going to see the systemic changes to address? And another good example of that is for those who are now required by 2014 to enroll in a health insurance program if their employer doesn't provide it. There's a mandatory benefit package. Well, everything that you add on costs something. There is no free lunch.
No.
And I think the sooner we realize in healthcare that there is no free lunch, we'll be better able to protect Medicare and healthcare services for those who can't afford it in the long term. But if we don't, that's the major issue in getting our out-year deficits and debt under control. It's simple demographics and math. And the math doesn't lie. I mean, over the next 40 years, the population over 65 is going to double. And the population under 65, working age, is only going to go up 30%. Well, the math there, if you know how Medicare is funded, which is through a payroll tax by those who are working, paying for those who are retired, not working, something's got to give.
It doesn't work.
It doesn't work. So we should be spending time now trying to fix it today instead of waiting for 20 years.
And you know, people talk about it, and look, I'm living proof of what Medicare can do for you right now.
It's a good program, but we got to protect it for the future.
But there are things that I've experienced in the last 6 months as I've battled my illness that are nuts. There are things that Medicare allow that, I mean, it was good for me, but not very
sensible
smart.
cost containment things, I would imagine. Yeah.
I mean, I could have had 6 second opinions.
Yeah.
At $3,000, $4,000, $10,000 a clip. Doesn't matter.
It's a good example.
That's not a good thing.
That's not a good thing.
But how do you, a Democrat, in the second or third most democratic state in the country, go to your constituents and say, we got to change things. Everything that you're getting now, you can't continue to get all that. How do you do that?
Well, first of all, you have to engage in a conversation and explain the challenges and the issues that we face. And we just did 2 town hall meetings last week where we talked about deficits and debt, and healthcare was being such a big part of it. And help educate people and then work together in coming up with a solution. As I said, for those who really care about Medicare and Medicaid and those kinds of programs, and most Democrats tend to be the ones that do, the question is, do you want to preserve them for the long term? And if you answer that, as most will, yes, well, how are we going to do it? Let's work together to do that. We have really 2 options. The premium support, we're going to cap spending at a certain level and allow the market and beneficiaries to respond, or to work within the system to reduce costs and utilization and fundamentally the incentive structure in there for providers.
Thank you, John.
Thank you. Good to be with you.
You're connected with Content Delaware.